how you can give. If you have been blessed by the ministry at ATN and would like to partner with us, you can join the ATN family by giving your charitable gifts. Giving to ATN can be done in multiple ways. On your tithes envelope, there is a designated line for ATN. You can place your donations along with your tithes and offering. Sign up to become a monthly or a one-time sponsor using the ATN donor pledge form that is provided in a pinned post on our Facebook page. After you sign up, we will contact you to make arrangements of how you can make your donations. You can mail your checks to House B Upper Flat 374 Mayflower Crescent, Lake Garden, Ladyville Village, Belize District, or drop by our studio on weekdays, Mondays to Thursdays between 9 to 5 p.m. at our ATN office or Central Belize Mission office. You can also make direct transfers marked for ATN via online banking or in-person deposits to the following bank account number. For our international donors, you can make your donations via the PayPal app or by sending donation to BZ Adventist TV by means of the following link, using your PayPal account or your credit and debit card. Thank you for your generosity, and we pray God's richest, most abundant, and continuous blessings on you and on the Belize Adventist Television Network as we seek to engage in meaningful, relevant, and life-changing ministry in today's world.
Good morning. This is Defining Your Health, and I'm your host, Dinah Moralez. This morning we have a special segment for you. Yes, we are talking about dental health, and we did a special show for you at Dr. Raphael Samos Dental Clinic, and it's something very interesting that I'm sure you will love to see. Get your kids close because they too can benefit from the information of this special segment for our Defining Your Health. So stay tuned, and we hope that you enjoy. Let's get to it. Good morning, and welcome to another edition of Defining Your Health. I'm your host, Dinah Moralez. I hope that you are enjoying this beautiful Tuesday morning. I want to thank you for joining us, those who are watching on Facebook, on YouTube, and on Channel 98. Thanks for being with us. Once again, we bring to you a very important health topic, and that is dental health, one that we don't talk much about. But today we have the expert in the field who is going to be sharing his expertise with us to help us make better informed decision when it comes to our dental health. My guest for this morning is Dr. Raphael Samos, and he's a senior dental surgeon at the dental department at the Ministry of Health. Good morning, Dr. Samos.
Good morning.
How are you this morning?
Okay.
Okay, so I know dental health is one that I know personally. I run away from it a lot because it's something that I'm kind of scared about. When you hear dentists and going in your teeth, and then you see all those long different instruments, you get kind of scared, right? But let's briefly tell us about your background and how many years you have been a dentist.
Before you go there, you're not alone when it comes to being afraid of a dentist. I mean, it's a phobia people tend to have
right,
on our
right.
I'm the senior dental surgeon in the Ministry of Health, in the dental department. My studies as a dental surgeon was from 93 to 97 at the Universidad Autónoma Metropolitana in Mexico City. Hence, after that, I went in to specialize as an orthodontist. That's from 97 to 99. 97 to 99, yeah. At CEO, Centro de Estudio en Ortodoncia. No? During the dentistry career, also I specialize as a dental technician.
Okay.
And that's the person who actually does the teeth itself from scratch.
Oh, wow.
Yeah.
Okay.
In that career as a technician, I also specialize in porcelain inlays, porcelain crowns, both anterior and posterior. Officially, I make up, as of the Gazette of 28 March 2020, we are 65 registered officially, legally practicing dentists in the country.
Okay.
Medics are 470, which a total between medics and dental surgeons encompasses 535. I came back in June of 99 and started working for the government. Well, obviously I registered with the Medical Council, and I started working with the government from December 8th of 1999 up till now.
Okay, so
I started as a normal dentist, and 2-3 years after, I was moved up to coordinator of the whole central region, which involves the whole Belize district and the Keys, which is San Pedro and Kikapa. And then in 2008, I was given the post of senior dental surgeon.
okay, so a little over 21 years you have been in this field, and what made you choose this career path?
It's I'll be honest with you. At the beginning, and I'm talking about from primary school days, I guess I go along and just like any other person who still cannot make up its mind, his or her mind of what to be in life. I was thinking on becoming an accountant when I was in primary school. In high school, I wanted to be a pilot. Sixth form, I wanted to be a lawyer.
Wow.
And then I saw the advertisement by the BDF, Belize Defense Force. Were advertising posts for dentistry, and I said, you know what, let me try it. So I went ahead and I applied. I got the post. I managed to get the scholarship, but I only did the basic military training in Mexico City
Okay.
at one of the biggest training centers, which is Heroico Colegio Militar. I did a CAMBI, which is the basic military training, includes it's called the Curso de Adiestramiento Militar Básico Individual, CAMBI.
Okay.
I came back. I still felt that there was no, I wasn't getting the full gist of what dentistry should have been. I came back. I worked for about a year and a half, gathered some money, and then I went back and presented the exams at the Universidad Autónoma, UAM Xochimilco, whereby I got in, and from then on, the whole dentistry started for me.
Okay, so I can see you have years of experience, Doc. Not only educationally, but also in terms of experience. You've worked in all these different areas. I know you've mentioned you worked with the BDF, and I know for some time it had to be your commitment to the job as to why you're at the post that you are now. Let's talk a little bit of, or a topic for today is dental health. People like to think that dental health only involves the actual teeth, but I know it goes far beyond that. So can you briefly share with us what all does dental health encompasses?
Well, dentistry on a whole, it's a complete job. I can relate to. It's like, for instance, it's a profession whereby one is do bridges like the engineers. We do crowns like florists.
Right.
We carry out jobs with cement like masons. We solve root problems like mathematicians. We make you wait sometimes like the brides. we may make you feel sometimes pain like the bankers. And for this and many more other things, we are admired, and we always leave you with your mouth open in awe.
That's true. I like that one at the end, Doc. Indeed. So, a dentist. So, you have dentistry, it's a field. A dentist is a person, it's the actual occupation, the post in the field.
Yeah.
And you're saying that when you're a dentist, you have to possess all these different skills.
Yes. It is true, and not only that, in Belize, well, because of the small population, most dentists do everything.
Okay.
I have friends outside, abroad, that they dedicate only to like braces, for instance. But I guess in Belize, we have to survive doing everything.
Right. And that leads to my second question, because I know dental health and oral health go hand in hand. But as a dentist, what is your primary role in this field?
You tend to bring back the confidence on a person by as soon as you give them their smile. It's compensated by the smile and confidence that you can give to a patient. It encompasses, once you have that, you know that the person will, self-esteem, it builds up. You have that ability to build it back. A person comes shy that because of the way their teeth are, they don't want to even smile at you. Mm-hmm. So you bring back the self-esteem as soon as you finish helping them out, no, or fixing them out. We are here also to solve their, most of the time, immediate problem of relieving them of acute pain. Most of the time, and it's sad to say it, but some people only visit the dentist unless they have a toothache. Mm-hmm. Which should not be. It should be like at least twice a year, no? At least. So bringing back the self-esteem and being able to have that smile back, it opens doors for that patient. It gives them that opportunity to maybe seek a job. I mean, take for instance, well, right now you won't be able to see much because of the mask wearing. But imagine people on a newsroom and their front teeth are not looking good. I mean, who would hire that person? You know, it really it plays a big role in.
Right, and I like what you said there, that you guys bring back self-esteem and confidence, because your job is to indeed help with whatever condition they come with. But as you mentioned, not everyone feels comfortable coming to a dentist. It may always be the last resort that a person would go to. I remember I had some headache for some time, Doc, and it was around the area of my ear, so I went to my ENT. I thought it was a ear problem, and so when I went to him, he said, "No, it's not an ear problem. Your ears are fine." He said, "I think maybe it's like a tension headache coming from your eyes." So I went to the eye doctor, and he said, "Well, you need a little up in your prescription." I said, "But that wouldn't cause that much of a headache." So he sent me back to the ENT. When I went to the ENT, he said, "You know what? You need to visit a dentist, because sometimes these are what you call referral pain, and the other person that will be able to help you is a dentist." Now, in my mind, there was no way that I would have gone to a dentist as first, preference in terms of a headache. But going to the ENT and to the eye specialist, they referred me to the dentist. That just speaks a lot, that a lot of the time people don't really, how you say in layman terms, say, "Well, I don't have a need for a dentist, only when the teeth hurts." But we don't understand that there's so many other situations and complications that can come from your teeth that may not be so obvious.
Yeah.
And then that would cause you to suffer for some time before you get the help you need.
Yeah, in fact, we can go as far as a dentist can detect if that person, from seeing the tooth itself, can detect if that person is under stress. The way the teeth are, if they have worn down, they have grinding, if they're grinding their teeth at night, that's a sign of stress that you go through. It's called bruxism, and what happens there is that you build up the stress during the day, and somehow you release it at night. But during that process, you're grinding your teeth, and you will notice it because one, the tooth becomes sensitive, and two, you will develop problems and pains right here on the cheek, on the temple, all this area. You'll find it tense, and that's a sign that you're releasing that stress during the night. In the morning, early in the morning, you'll find that pain starting.
Yes, indeed. And the program today, to our viewers that are watching this program, I hope that you're learning what we're talking about today, because at the end of this program, I want you to understand how important dental health is and how you need to look after your dental health. Before we go into a break, Doc, I just want to talk a little bit about the importance of dental health. When I went to the dentist, he told me that my wisdom tooth, they were, I think the word is impacted, and it was causing the pain. Now, I had no knowledge that an impacted wisdom tooth can do a lot of harm, and that is why I think a lot of people need to go and see the dentist, because a lot of the issues, the pain that you're feeling, that you say, oh, it's just going to go on its own, these can cause serious problems. I've heard persons say before that, one infected tooth can do a lot of harm. So yeah. I want you to take this special moment to let them know the importance of dental health and why they need to look after it.
Well, it's a whole lots of factors that are being influenced there when you're not taking care of your teeth itself. Now, I mean, from the mere fact of your digestion itself, not having enough teeth will cause a problem for your digestion. Remember, all the teeth have their own function. The front one, for instance, for the same reason that they're called just like scissors, the incisors are used for cutting. Then you wear it down to the canine, which are used for tearing like big pieces of meat. If you compare a tiger, that's what he uses to tear down the meat. Then you have the fine cuts, which is the thicker cuts, which are the premolars, and then the fine cuts, which are the molars. And it's amazing the way they are positioned helps in the full digestion, because there's a flow from the way you cut it and you bite it and you tear it until it becomes a ball, which is the bolus, which you swallow afterwards, after, of course, adding the saliva to help in the digestion. Everything plays a role. So anytime a piece of the puzzle is missing, a piece of or a tooth is missing, you are affecting the way you're eating, the food that you're going to be digesting, and it poses other problems. I have seen patients that they're saying, oh, you know what, doc, I only eat on this side, and for some reason, that is already affecting the digestion, because first of all, you are developing this area, the muscle area is developing higher more than this side. You're not evenly distributing the forces that you need to
also,
use.
Wouldn't it affect the nerve as well? I've heard that a lot of the time it said the nerves get affected when there's infection and you do not attend to it.
Yes, the infection goes from it starts, the cavity itself starts from the mere formation of cavities of a very, very fine little point, the size of maybe the point of a pencil. And as soon as you have that, you might feel a little bit of sensitivity. From there on, you know that something is wrong. It's not normal. But most of us tolerate it. They say,
you go buy the sensitive Colgate.
Yeah, we'll deal with that later. And that later and later starts the problem, because that cavity will not get small. It will only get bigger over time.
And you lose your eventually.
Yep. And of course, if we were to compare the size of the nerves that really have clicks the stimulus telling your brain, hey, I'm having problems here. when we do root canals, we realize that it's the size of a strand of hair.
Wow.
But those little ones are the ones that inform you something's starting to be problematic here. And it's easier to, that's why it's recommended that you immediately see your dentist. Don't wait till it becomes a huge problem. Because apart from it, if you detect it on time, the price that you will pay also to solve it is much cheaper than having to go through root canals, having to take out a tooth and put a bridge. I mean, it goes from like a $50, $10 all the way up to hundreds and thousands of dollars. I mean, implants and those things, you're talking about $3 to $5 grand. So the earlier you do it, the faster and the better off, and more money you will save.
Right, and I think you mentioned earlier, you help your patients to have that nice smile. Our teeth are not only for eating, they're for talking properly. They're also for giving that bright smile, as you mentioned. And we all want to have a good smile.
Yes.
We all want to enjoy our food. So in order for that to happen, we need to take care of our teeth. And I like what you mentioned that as it relates to the importance, if you deal with it early, then you see them. And I think that's something that we really need to take into consideration, viewers, because if we prolong a problem, it ends up costing us more. But if we deal with it early, you know, one, it can get solved, and two, it won't cost you as much. So we hope that today's program is going to help you. By the end of this program, that you are going to learn what are some things that you need to do. In our second half, we're going to do a little bit of demonstration. Also, we're going to talk a little bit about what are some of the common dental problems and diseases that affects us, and what are some of the things that we are doing to cause this to happen to us. So I want you to stay tuned. We'll be right back.
A study published in the Journal of the American Dietetic Association found that toddlers aged 12 months and older consumed a third of their daily calories from snacking between meals, with the snacks becoming less nutritious as the children got older. Dietary patterns low in fruits and veggies and high in sweets and saturated fats began to develop between the ages of 12 months and 24 months, and this pattern tended to be established by 24 months. That's a fact. But there's hope. Parents can establish the foundation for a healthy diet early in life when eating habits and preferences are being formed. Simple dietary changes, such as offering more nutritious snacks, can help prevent obesity and chronic disease in our children. So switch the gummy bear for blueberries and see them growing healthier and happier.
Hi, my name is Amini Anderson, and I'm the General Manager for our Yadpa bookstore here in Belize City. At our bookstore, we cater at offering books that can help you live a healthier lifestyle. We offer books that can help your marriage and your family life to be even more sweeter. We haven't forgotten the kids, we have books for them, and we also have books that will help you grow in your spiritual life. We're located inside the headquarters of the Belize Union of Seventh-day Adventists that is located on 3A Street, Kings Park. Our phone numbers are 223-3048, or you can get us on our cell number at 660-2378. Our working hours are from 8 to 12:15 from Monday to Thursday, 1 to 4:15, and on Friday we're open from 8 to 12. You can also find us on Facebook. Our name for our page is Yadpa Belize. ATN has partnered with us, and for every purchase made using the code ATN21, a proceed will be going to them to help them further in their ministry as well. So feel free, come visit us. I'm sure you're going to find something that will be a blessing to you all. Thank you.
More than 32% of adults over the age of 20 suffer from high blood pressure, according to the Center for Disease Control. High blood pressure is a major risk factor for cardiovascular disease and mortality, as well as among the top causes for other chronic health conditions. Anger and frustration has been shown to raise the level of stress hormones in the body, triggering negative health effects such as high blood pressure. That's a fact, but there's hope. Those with hypertension have seen dramatic benefits from learning to forgive. In one study, those who scored high on anger test no longer required blood pressure medication when participating in a forgiveness program. As someone said, you simply cannot swallow a poison pill and hope the other person dies. So forgive now and see your blood pressure going down.
Abigail.
Yes, Gran?
Abigail, I can't breathe well.
Granny, we need to go to the hospital to get you checked out.
No! I'm fine.
Yes, Gran, we need to go now to get you treated. Now, before it's too late.
No.
Grandma, we need to go for all of us.
No.
Stop. If you are having flu-like symptoms, please call us immediately for medical guidance. If you have chronic conditions such as diabetes and you are experiencing symptoms such as shortness of breath or chest pain, please also seek medical attention immediately. We lost a lot of people this year. We don't want to lose you too. Please seek help if necessary. Call us at 0800-664-2273. Continue to wear your mask at all times. Keep physical distance when in public and stay at home unless absolutely necessary. This message has been brought to you by the Ministry of Health and Wellness.
Are you taking heart medicines? Medications can give us a false sense of security. Even if a person takes heart medicines, eating a lot of saturated or trans fats, fast and junk foods, red and processed meats, sweets, and processed foods will still increase inflammation and make cardiovascular disease worse. That's a fact. But there's hope. A study of more than 31,000 adults found that you can substantially reduce cardiovascular recurrence beyond drug therapy alone by eating a diet rich in vegetables, fruits, and fish, and low in meats. A heart-healthy diet reduced their risk of dying from cardiovascular disease by 35%, a new heart attack by 14%, heart failure by 28%, and stroke by 19%. So eat your veggies! A healthy heart starts with a healthy meal.
Welcome back. Thank you for being with us for Defining Your Health. Today we are talking about dental health, and we're here with Dr. Samos, who is the senior dental surgeon for the dental department of the Ministry of Health. And so before we went to our break, Dr. Samos, we have already talked a little bit about dental health, what it encompasses, what is the main importance of taking care of your dental health. And now we want to talk a little bit about dental diseases. What are some of the dental diseases that you have seen during your 21 years in the field?
It varies. There's a whole pile of them. I mean, books are written on them, but what are commonly seen here is the one caused by bacteria that causes the cavities itself. People come with dental abscess, destroyed tooth, ulcers, aftas. You have parodontal problems whereby bone has been lost. On babies, we also see what we call the baby bottle syndrome. We see rampant caries that it starts from one side, it spreads to the rest. I have seen some mothers denying also when I tell them, you know what, that's a baby bottle syndrome. Mm-hmm. And it's easily identifiable when, just as an example, no?
Right.
A baby patient comes and you could see the top front rotten, destroyed completely. Then you see the back also are starting to eat away with the cavity itself, and then the bottom ones are also affected. And the only ones that save themselves most of the time is the front bottom. And the reason being is that if you notice where you put the baby bottle itself, the tongue protects those bottom front teeth. So it is sad, and when you see that, because sometimes you have to understand that some parents are working parents and they don't have the time, but it leads to that. Now, when some parents say, "Oh, my baby was crying as I had to put a little bit of sugar in that milk just to ease them, and that's the only thing that eased them." Fine, but what do you do after? Do you clean it? Do you take the time to clean it? You know, because I mean, you have many ways of solving a problem, but if you're not really attacking what's gonna cause it and leave it there, that problem is gonna escalate.
And that's true, Doc. I can remember when I had my first, when I had my daughter, the doctor, like, even though she didn't have any teeth, she was like, make sure you practice good dental care. And I was like, what is he talking about? And then he took a rag, he wet it, and he said, whenever you finish breastfeeding, make sure you take it, you wipe out the mouth, wipe the tongue and everything. And he will tell you, do this when she started having teeth, then you need to do with the toothbrush. And he said, make sure you keep up, even if she's not having a problem, bring her, make sure everything is going. He said, because if you take care of her from this early age, she would go on to have really nice teeth. And that is so true. I have an aunt and an uncle that no matter where they are, if they have breakfast, lunch, or supper, they walk with their toothbrush and their toothpaste, and right after they finish with a meal or something, they will brush, they will floss, and they have not had to see the dentist for any procedure or anything like that.
Yeah, and it only takes about 20 minutes after you have eaten, the bacteria starts to produce that acid, right? 20 minutes after, that acid starts to destroy the teeth. 3 hours after, that acid continues to dissolve the minerals of the layers of the teeth and starts to penetrate. So imagine if you did not brush from the morning all the way to the night.
And then sometimes people drop asleep at night until the next morning.
So
you're leaving it there.
Yep. So those bacteria are having a feast in there.
Oh, wow.
Yeah. So it only takes a little while before that starts.
So these are some of the common dental problems that would find its way to your office.
Yes, and it's amazing when it comes to dentistry itself, because 90% of all systemic disease are detectable through the mouth.
Really? Really?
So we have some that come to my mind are leukemia, cancer, oral cancer. You have pancreatic cancer. You have osteoporosis. You have diabetes. There are several of them that can be detected through the mouth as well. So there's a range of disease that you can still see. Remember, the mouth is the main entrance
Into the body.
to the body. So once it comes in, then it starts the problem.
Okay. Now, let's talk symptoms because maybe something can be happening. Those of you who are watching us at home, maybe something can be happening and you are not being aware of the symptoms. So for these diseases or these common dental problems, what are some of the signs and symptoms that are going to present itself when you know I need to go and get checked?
You will find the basic one is the initial one will be a little bit of sensitivity on the teeth.
Okay.
As small, as minimum as it is, make sure that you check it because that's where it starts.
That's when you can't do hotter, you can't do cold, right?
When you reach that stage, then it has advanced already.
Oh.
It has gone a little deeper into the second layer, which is more sensitive. Second layer of the tooth, no?
Okay.
I can show you here.
Okay.
It has the first main layer, which is the enamel, and followed by the dentine.
Okay.
But this has communication directly to the nerve.
Okay.
So it starts a little point of cavity that this will start to detect it. Once you reach to this stage,
It's
the
already getting bad.
the cavity goes faster because this layer is softer. One of the hardest substances in the body is this first layer, enamel.
The enamel.
Yep.
Okay. All right. So I can see on your demonstration there, Doc, where you have like the blue color and the red. Those are your nerves.
That's the whole pulp or the nerve package, which includes the artery, the blue, the vein, and the nerve, the yellow.
Okay, so when it gets down to there, that's when you feel like it's in your brain.
Yeah.
The
yeah.
pain.
That hurts.
That's when it's bad, and that's when you have to do
But
like root
there
canal.
is solution.
Okay.
There is a solution of doing root canal depending on how severe it is and how much destruction has occurred. You can do root canal to save it, remove all the nerve all the way to the root tip. Special fillings, build up the tooth and put a cap. Obviously the prices go up too for you.
Now,
For that treatment.
what can we do for my viewers at home watching? What can we do to avoid reaching to that stage?
Visit your dentist, make he help you do a total exam every 6 months.
Every 6 months.
At
So
least every 6 months.
every 6 months, you need to visit your doctor. That's with or without symptoms.
Yeah.
With symptoms, you should go.
Sometimes you don't
quicker.
feel it, or sometimes the tolerance of pain is higher. You could
Okay.
tolerate more pain than me, for instance.
Right.
So I might say, you know what, I don't pay it mine because it's not hurting me. But in reality, you don't know what's inside happening. You know,
Right.
it could be something that you might just take it for granted,
Right.
right? Until it reaches a really bad
A
stage.
really bad stage where you really need to tend
yep.
to it.
Again, the next good practice would be making sure you eat healthy snacks.
Okay.
Right? Avoid
Sugary.
chewy, sticky
Sugar.
food on a whole. Caramel, those are one of the worst because it sticks to your tooth and it feeds the bacteria. So those are having a feast there. It's like bringing, I don't know, wine into a party for whoever wants to enjoy a party, no?
Right.
Or the food
so
there.
those are some of the detrimental things that we can do that will cause us to have some of these common dental issues or diseases if we are not as careful. And what I want to kind of stress a lot on today, Doc, is one, the importance of brushing. Brushing is not only for your teeth to look white. And I know there's vast amount of products out there that promises to give you what they call it, sparkling white teeth. You have so many different Listerine to help with gingivitis
The
and
flavors,
gum disease.
don't forget the flavors.
Mint, yes, all of these.
Chewing gum.
Yes, all of these things are out there that promise to give you help for all of this. But I know one of the main things that many people don't really, they overlook, I would say, is that the simple brushing.
Yes.
Brushing and flossing, how important it is. So maybe you can talk a little about the importance of brushing and flossing and how often should we do it and the proper way of doing it.
Yes, it's amazing about a small toothbrush that costs you maybe what $152
Right.
avoids all those complicated problems that run into thousands sometimes. Yes, the way you brush is very important. The amount of time that you brush, especially after every meal, and if you have in between snacks, you should brush. Don't allow no food to stay there. That's where the problem starts.
Right. So I see you have a small little mouth here. Maybe you can hold that up to our camera so our viewers at home can see as you demonstrate the proper way to brush the teeth.
The babies, I will show you basically 3 types of techniques.
Right.
Babies on a whole, there's a technique called funds, and the reason why it's developed is so that they get into the habit and they reach to acquire a taste for the Colgate, for whatever toothpaste they use. No? So
Okay.
the idea is to get them being able to hold their toothbrush, monitor them, and you do circular motions.
Right.
Right? For them, at the beginning, I know some kids don't like that and they cry, but
Right.
they have
You're hurting
others.
my gum.
Yeah, but they have others who they can't wait to brush. And they have those. So the idea is to get it into a circular motion, to get them going, get
Right.
all those things clean. You know, all the circular motion, and that's the outside. Then you go into the inside as well. Brushing as much as you can. A little more.
Right.
And that's the top. And you go to the bottom the same way. At an angle.
On the angle, right? So you want to make sure that the little part, the frizz of the brush goes in between the teeth, right?
And at the beginning it will be not that easy. But as long as they start to get rid of all of that food, it will help them a lot.
Right.
The inside, same way, if you could, depending on how comfortable they feel, like this, or like this, depending on, you could notice how best they feel, right hand, left hand. You as a parent will know what's their best angle to attack the problem.
Right.
Huh?
Right.
After finishing all the teeth, don't forget the tongue. It's
Right.
important to brush the tongue outside. Remember, we have what we call the auto cleansing, which is you do it unconsciously.
Okay.
You go like this sometimes, especially after you have finished eating.
Finish eating, right?
Yeah.
Right.
And that is a very important part of the brushing itself without a toothbrush. But with a toothbrush, imagine washing or mopping your room with a dirty mop. It won't work.
Right.
So you have to make sure that you clean it off.
Clean it off.
Yeah.
Clean
the tongue.
Clean the tongue. The
Clean
tongue
the
is the
tongue.
mouth.
As far as back as you can. Handle it.
And a lot of people like to say, "Oh, I don't like to brush way at the back because it makes me gag."
Yep. Just as
Very
far
important.
back. As far back as you can handle.
And I know, especially when it comes to proper or nice smelling hygiene from the mouth, they say a lot of time most of the bacteria stays on the tongue, so that's why you need to brush the tongue properly.
That's right. And this is for the kids. Now, as soon as you start to develop or change your teeth, which is more or less about the ages of 6, 12 years, you need to change the technique.
Oh, really?
Yes,
I
you
didn't know
do
that.
need to change it. That brushing that you used to do like that changes also.
Oh, okay.
From here on, after you have started to change it, you go with what we call a Stillman technique. And that is applying it the way it grows.
Oh.
At an angle, the bottom ones towards the top, all along.
Okay.
Inside the same way.
So lifting the dirt out.
Uh-huh. If you're comfortable doing it this way or that way, as long as you get rid of all that food, it's like riding a motorcycle.
Right.
You know, you get that wrist going. And here you could do it this way or this way.
Okay, so there's
As long
different
as
method.
Yeah, as long as you
The
brush
overall
that,
goal is to take out these
get rid of that food.
food. Okay.
Get rid of that food. And the top ones obviously grow downwards, so they will be brushed downwards. All around.
Now I have a question, Doc. Sometimes when you're brushing and you see there's blood, would it mean that you're brushing too hard? Whatever technique you're using, that, or it may be the type of toothbrush that you, because I know that they sell the soft, the medium, the hard. What would
for
you?
kids, the small and soft is good.
It's better. Okay.
Yeah, for adults that have no complication, you could get a soft and large toothbrush. If you're starting to see a little bit of blood, you might want to change to large toothbrush in size and medium in strength. Now, if you develop that most of your gum is bleeding, then you have to get hard toothbrush and large toothbrush for adults.
Okay.
Because you need to get that, by that time you already have tartar. You need to start to get rid of much of the tartar as possible.
Okay.
Because that tends to accumulate. And I have seen it most of the time, it accumulates right in front, on the bottom. Right? And some people, it's because they are afraid to mess up the mirror. They forget.
So they forget to brush at the front.
Yeah,
Right?
so that plays a huge role there.
Now, is there, in terms of the common dental problems that we've spoke about and the diseases, is there a specific age group that would tend to suffer from these problems?
Actually, no. The cavities do not respect age itself.
Okay.
In fact, there has been studies found out that even on unborn child, they have found cavities on teeth.
Wow.
So it goes to show that bacteria can spread from the mother to the child. It's very rare, but it happens.
And also, as you're talking along with newborn, I know sometimes mothers, when they're carrying their infant, when they're pregnant, they lose some of their teeth.
Yeah.
What would attribute to that?
It's a hormonal change that they go through, but some I have heard a lot of mothers say, with every child I have lost a tooth, and that should never have been.
Once you're practicing these that
Exactly.
you're mentioning, so in the sense when it comes to that, it's not really about dental care to an extent. That has more to do with the deficiency.
Yes, and I mean, basically, look at it this way: a child has not even born it, and he's being blamed for your tooth. Come on.
Right.
cannot-
Right. Right. So once we practice the proper way of brushing our teeth,
Yeah.
we should not have as much problem.
But at the same time, pregnant mothers, because of the hormonal change that they go through in preparation for the birth of the child, the gums tend to be a little bit more flaccid.
Okay.
Because of that, food tend to get easily in between the gum and the bone. And that's where a problem can start. So what they have to do is brush more often. Make sure, and I know some pregnant mothers have those urges to, hey, I want chocolate, I want biscuit, I want ice cream, get me this, get me that, you know.
And also, I noticed that some pregnant mothers said usually in the first 3 months when they have their morning sickness and they would vomit also, I have heard, maybe as a dentist from your professional perspective, you can let me know if it's a myth or it's true. When they have already vomited and stuff, it's not good to brush your teeth directly after because it does something to the teeth.
The vomit itself has the digestive acids now, which help to demineralize the first layer of the tooth. So yes, it affects. It does affect. By basically using a toothpaste that has the fluoride in it, it helps to bring that back, bring the strength back. So I would still go ahead and brush.
Okay. Now, in the beginning, we spoke a little bit of your portfolio and what you are doing at the Ministry of Health. But let's talk a little bit about that. What are some current programs that is currently in place, or what are future programs that you guys would like to put in place to kind of help to minimize the stigma? There's a stigma when it comes to persons going to the dentist. And I would believe, or I feel that it's safe to say that a lot of these problems that we've been talking about, surfaces because of this phobia of going to the dentist. So what are something that from a ministry level you guys are working towards and trying to help adults and children to be able to, want to go to the dentist, want to get checked, and to take care of their dental health?
Yeah, we have 5 major programs that we run. Some districts don't have all, but the majority does do the 5 of them. The first one is the normal outpatient care program, where you come into the normal clinic and you get the service that you require, whether it's medication, a tooth that's giving you trouble. That's a normal outpatient care program. Then we have the program for pregnant mothers, the MCH, maternal child health, whereby we have in the past requested that all pregnant mothers come into for your appointment at least once or twice during your pregnancy. Okay. We have been pushing that program through the maternal child health program for the ministry, and over the years, I know I have managed to get the agreement that nurses would direct, and in fact, in their pregnancy card, there's a section that has to be filled by a dentist. Okay. And it should be filled by a dentist. Don't allow a nurse fill that, because then you're beating the whole program. No? And the reason being is that they could come in, we check them. If they need a cleaning, we'd let you know. If you have a problem, a total exam of what you will be needing throughout just in preparation, so that you are safe and go through your whole pregnancy nice and easy. No? I mean, then we have also the mobile outreach, whereby we go to the villages, and most of the time we station at the schools itself. Of course, right now it has slowed down because of the same pandemic.
Right.
But we do visits to the villages, station at the school itself, whereby we ask all the kids, as much kids as we can manage, depending on the size of the school too. We can't do the whole school at once, but we try as much. We give them dental education, we do the toothbrushing drills, we do fluoride treatments. On occasions, if there's 1 or 2 teeth that are really bad, that has no solution, we remove them. And we also try and work with the teachers themselves. And as a way of incentives, we give out toothbrushes. If we have any other material educational material, we also provide the teachers with them. And then we have the dental education in town or in the city. We go straight to the schools. We set up PowerPoint presentations. We teach them the functions, the parts of the tooth. And it has been, I noticed it has been very acceptable by the school itself. And in fact, they have reached a point now that whatever we are teaching, they use it also for exam or test for the kids. Nice. So the kids now have to focus and learn what we are teaching, and it's sometimes a challenge, but it's something that we have worked on, and we also do the toothbrushing drills for them, and sometimes even the fluoride treatment. So it's something that's working. And then the last one is the program, the prison program, which is only done by Central Region. Obviously, right now, also because of the pandemic and the security reasons that we are having there, it has been slowed down as well.
Right.
But 5 of them.
I like that. I like that, and I can see you guys are working hard to make sure that in terms of education, they're getting the information that they need. And I like that the schools are having the children be more focused, because that way they will be better able to retain what they have learned and also apply it into their life. So I'm thankful for that, and I also know there's various programs that you guys do sometimes in giving out free toothbrush and toothpaste so that individual can practice this proper brushing of teeth. So that's all the time, sadly, that we have for today, Dr. Samos. But I want to thank you so much for the time you took out of your busy schedule. I know you have a very, very tight schedule, but you have made time for us today, and I must say that we appreciate it here at ATN, and I'm pretty sure that our viewers at home appreciate your knowledge and the advice that you have given in this program today. And to our viewers at home, we want to thank you so much for joining us once again for Defining Your Health. I hope that you have learned something from this program today and that you will apply it and take care of that pretty smile. So once again, thank you for being with us, and we look forward to seeing you next time for another episode of Defining Your Health. Take care.